Get ready to learn the truth about fruits that has been hidden from most people. Contrary to popular belief, some of them can accelerate the aging process, negatively affect brain function, and raise blood sugar levels to critical levels, even exceeding the harm from sugary soda drinks. In 2023, the authoritative American Journal of Clinical Nutrition published a study that showed that in people over 65 who regularly consume certain types of high-sugar fruits, the risk of developing metabolic syndrome increases by as much as 57%. This condition poses a serious threat, increasing the likelihood of stroke, diabetes, and heart failure. It is especially alarming that these fruits are often presented as healthy and promoting better digestion, while in reality they can cause hidden harm to the body every day. After 65, metabolism slows down, cells become more susceptible to damage, and sugar tolerance drops sharply. This means that eating the wrong fruits can lead to serious consequences in the shortest possible time. However, there is also good news. There are fruits that can be called real natural medicines for older adults. They help lower blood pressure, strengthen the cardiovascular system, and even rejuvenate the brain. Next, we will talk about 4 fruits that are recommended to be included in the daily diet of elderly people, as well as 4 that should be avoided at all costs. It is especially important to pay attention to the last item on the list of dangerous products. This juicy and beloved fruit can imperceptibly deprive you of energy and shorten your life. At number 4 on our list is avocado, an amazing fruit that deserves special attention. Contrary to outdated ideas about the dangers of fats, avocado is a valuable product for the diet of older adults. The uniqueness of avocado lies in its rich content of monounsaturated fats, in particular oleic acid. Scientific studies confirm that oleic acid significantly reduces the level of bad LDL cholesterol and increases the level of good HDL cholesterol. This favorable fatty acid composition makes avocado an indispensable product for older adults who care about the health of their heart and blood vessels. Improving the cholesterol profile is directly related to reducing the risk of heart attacks and strokes. But that's not all. Avocados even surpass bananas in potassium content, about 975 mg per fruit. This makes it an effective means of controlling blood pressure, which is especially important given that hypertension affects almost 2/3 of people over 65. The potassium contained in avocados neutralizes the effects of sodium and relaxes the walls of blood vessels, naturally bringing blood pressure back to normal, without the need for additional medication. In addition to its beneficial effects on the cardiovascular system, avocado is a valuable source of lutein, a powerful antioxidant from the carotenoid group. Scientific studies confirm that lutein helps improve eye health and slows the development of age-related macular degeneration, one of the leading causes of vision loss in old age. However, perhaps the most frequently overlooked benefit of avocados is their ability to optimize nutrient absorption. Many vitamins and antioxidants found in vegetables, such as vitamins D, E, and K, are fat-soluble substances. This means that the body needs fats for their effective absorption. Including avocado in the diet along with salads or cooked greens can increase the absorption of these vital nutrients up to 15 times. This fact represents a significant advantage for people seeking to get the most out of the food they eat, while avoiding the need to take a large number of supplements. How to take advantage of all these benefits? Eating just half an avocado a day is enough to get noticeable benefits. It can be spread on whole grain toast, added to smoothies, or simply eaten with a spoon, seasoned with a little lemon juice. Regardless of the method of consumption, this fruit is undoubtedly a valuable addition to the diet, contributing to maintaining health in old age. Apples, which occupy an honorable 3rd place on the list, are a real storehouse of nutrients. Of particular note is their fiber content, in particular pectin, which has a beneficial effect on the intestinal microflora. A healthy intestinal environment, in turn, contributes to improved digestion, strengthening the immune system, and more efficient absorption of nutrients, which is especially important in old age. However, the beneficial properties of apples are not limited to this. They have a noticeable impact on cholesterol levels and overall cardiovascular health. Pectin, by binding with cholesterol during digestion, helps remove it from the body, thereby lowering levels of bad LDL cholesterol. Additionally, apples are rich in flavonoids, such as quercetin, which have anti-inflammatory properties and support normal heart and blood vessel function. It is also important to remember the role of apples in regulating blood sugar levels. Despite their sweet taste, they have a relatively low glycemic index, and the fiber they contain slows down the absorption of sugar into the bloodstream, preventing sharp spikes and drops. This property makes apples especially valuable for older adults with insulin resistance or type 2 diabetes. Apples, thanks to their high fiber and water content, create a remarkable feeling of fullness, making them an excellent tool in appetite management. It is important to note that actively chewing apples stimulates salivation, thereby reducing the likelihood of tooth decay and gum disease, which, unfortunately, are common with age. Regardless of color, red, green, or yellow, apples are one of the most accessible and versatile fruits capable of supporting almost all the body's major systems when including just one fruit in the daily diet. In second place is the pomegranate. This fruit may not immediately come to mind when choosing a daily snack, but for older adults, this ruby fruit is a real treasure trove of beneficial substances for the heart. Over time, arteries naturally undergo a hardening process, which can lead to reduced blood flow, increased blood pressure, and increased stress on the heart. The uniqueness of the pomegranate lies in its rich content of punicalagins, powerful antioxidants that can reduce oxidative stress in the arteries by more than 30%, as shown in studies published in the journal Atherosclerosis. In fact, studies show that the antioxidant activity of punicalagins can be 3 times higher than that of red wine or green tea. The accumulation of oxidative stress causes inflammation and narrowing of the artery walls, similar to rust in old water pipes. Punicalagins help cleanse the arteries, ensuring smoother and easier blood flow. In addition, it has been proven that consuming pomegranate juice helps lower systolic blood pressure by 5 to 21% in people with hypertension, which is a significant help for older adults seeking to control their blood pressure without increasing the amount of medication. Pomegranates have an amazing ability to support cognitive function and improve memory. In a study conducted by scientists at the University of California, Los Angeles, older adults who regularly consumed pomegranate juice showed a noticeable improvement in verbal memory compared to those who did not include this drink in their diet. This fact is especially important given that memory loss is one of the most serious consequences of aging. For people with dental problems, pomegranate juice is an excellent alternative, preserving most of the beneficial properties of the whole fruit without the need to chew. Even concentrated antioxidants in supplement form show promising results, although eating whole fruits provides the body with additional fiber and micronutrients. You don't have to drink a whole glass of pomegranate juice every day to feel its beneficial effects. Even a small amount of seeds or adding juice to a morning smoothie can bring significant benefits. Unlike many sweet fruits, pomegranate has a low glycemic index, which avoids sharp spikes in blood sugar levels. This makes it an ideal choice for older adults with prediabetes or type 2 diabetes. When choosing pomegranate juice, it is important to give preference to 100% pure product without added sugar. People taking blood-thinning medications should consult with a doctor, as pomegranate may slightly interact with some medications. Overall, pomegranate is not just a healthy fruit, it can extend the period of active health, supporting the youth of the heart and clarity of mind. At the top of the list of the most valuable fruits for the health of older adults are berries, namely blueberries, raspberries, and blackberries. This trio represents an exceptional combination of properties that slow down aging, surpassing many other products in this regard. The uniqueness of berries lies in their beneficial effects on cognitive function and brain health. These little gifts of nature are rich in anthocyanins, natural plant compounds that give blueberries their rich color and act as powerful antioxidants. When ingested, anthocyanins actively combat inflammation in the brain and enhance communication between brain cells. A study published in the esteemed journal Annals of Neurology revealed that elderly individuals who regularly consumed just 2 servings of blueberries per week experienced a cognitive aging slowdown of up to 2.5 years. In other words, their cognitive functions remained at a level typical of people 2.5 years younger. This protective effect of berries is attributed to their ability to penetrate the blood-brain barrier and directly neutralize oxidative damage in brain tissues. The beneficial effects of blueberries extend beyond improving cognitive function. Consuming these berries also helps improve balance and coordination, which plays a crucial role in preventing falls, a common cause of injury among older adults. Equally significant is the benefit of blueberries for the cardiovascular system. Numerous scientific studies demonstrate that regular consumption of these berries contributes to a noticeable reduction in blood pressure, increased arterial elasticity, and reduced inflammation in the elderly. These positive changes lead to a marked reduction in the risk of developing cardiovascular diseases, which is especially important given that heart disease remains one of the leading causes of mortality among the elderly population. Among other things, berries have unique properties that allow controlling blood sugar levels. The fiber and bioactive compounds found in blueberries help stabilize glucose levels after meals, preventing sharp spikes in blood sugar that can exacerbate diabetes or pre-diabetic conditions, which are common in older adults. The high fiber content in berries, about 8 grams per cup, also has a beneficial effect on the digestive system, promoting regular bowel movements without irritating the sensitive digestive tract. Just 1 cup of blueberries a day added to oatmeal, yogurt, or smoothies can noticeably increase energy levels, improve concentration, and even lift your mood. It is important to prefer fresh or frozen blueberries, avoiding the consumption of dried berries, which often contain added sugar, negating the health benefits. After presenting the top 4 fruits highly recommended for the diet of older adults, it is worth paying attention to the anti-heroes of the fruit kingdom, the consumption of which is extremely undesirable for older people. And let's start with a treacherous fruit that may already be lurking in the kitchen cupboard. So, the 4th line of the anti-rating is occupied by grapes. At first glance, these small juicy balls seem to be the embodiment of benefits and freshness. They are often positioned as a storehouse of antioxidants, especially dark varieties. However, behind this attractive appearance lies danger, especially for people of age. The main problem lies in the amazingly high sugar content with almost no fiber. Grapes are rich in glucose and fructose, and because of the ease of eating this fruit by the handful, it is easy to not notice how the permissible dose of sugar is exceeded. 1 cup of grapes can contain about 23 grams of sugar, which is comparable to a small chocolate bar. For older adults, who often have difficulty maintaining normal blood sugar levels, this can have serious consequences. The minimal fiber content leads to rapid absorption of sugar into the bloodstream, causing sharp spikes in glucose and insulin levels. These fluctuations are not just temporary discomfort, but a risk factor associated with weight gain, inflammation, and an increased likelihood of developing type 2 diabetes. Do not forget about grapes, which, if not grown organically, often bear the burden of residual pesticides. Older people whose immune system is weakened or digestion is particularly sensitive may be more susceptible to the harmful effects of these toxic substances. Even the thin skin of grapes, despite its softness, cannot boast significant nutritional value compared to the skin of other fruits, such as apples or pears. As a result, grapes, which seem so harmless, actually pose a hidden threat to the stability of blood sugar levels, which is especially dangerous for older adults seeking to maintain energy, a healthy weight, and optimal metabolic health. The third number on the list of undesirable fruits is dried fruits. Industrial dried fruits, often processed using sulfites, are one of the most problematic options for older adults. Despite their apparent benefits and convenience, the main danger of dried fruits lies in their extremely concentrated sugar content. During the drying process, water is removed from fruits, leaving behind fructose in its most concentrated form. A small handful of dried apricots can contain as much sugar as several fresh fruits, creating a risk of excessive fructose consumption without the fiber and water that usually signal satiety. This high concentration of sugar is particularly dangerous for older adults with diabetes or insulin resistance, as it can trigger rapid spikes in blood glucose levels even with small portions. Over time, this can lead to the development of type 2 diabetes or significantly hinder the control of existing diabetes. However, the negative consequences of consuming dried fruits are not limited to this. Rapid fluctuations in blood glucose levels contribute to increased inflammatory processes in the body, which can lead to exacerbation of pain and arthritis, accelerated cognitive decline, and even weakening of immune defenses, which is highly undesirable for older adults. Moreover, industrially produced dried fruits often contain added sulfites, preservatives used to maintain an attractive appearance and extend shelf life. These substances can cause serious asthmatic reactions in people with hypersensitivity, and older adults are particularly vulnerable to this risk due to age-related changes in respiratory function, as well as the higher prevalence of asthma and chronic obstructive pulmonary disease, COPD, in this age group. Approximately 1% of the population has sulfite sensitivity, but this rate is significantly higher among older adults with respiratory diseases. The inflammatory effect, due to both the high concentration of sugars and the presence of chemical preservatives, makes dried fruits a less suitable food for older adults with inflammatory conditions, such as arthritis, which affects about half of the adult population over 65. The second food that older adults should avoid is unripe bananas. Ripe bananas, covered in brown spots, can be beneficial for the health of many older adults, but green bananas present a number of serious health problems, making them one of the worst fruits for older adults. The main problem with unripe bananas is their high content of resistant starch. Unlike the easily digestible sugars found in ripe bananas, this type of starch is not digested in the small intestine. In older adults who already experience age-related changes in digestion, such as decreased production of digestive enzymes and slowed intestinal motility, this resistant starch can cause significant gastrointestinal distress, including bloating, gas, and abdominal pain. This problem is exacerbated in older adults with irritable bowel syndrome or inflammatory bowel disease, which are increasingly common with age. The difficulty in digesting unripe bananas goes beyond simple discomfort. It can impair the absorption of nutrients from other foods consumed during the same meal. This is especially problematic for older adults who may experience nutrient deficiencies due to medication interactions, decreased appetite, or age-related changes in nutrient absorption efficiency. In addition, the astringent compounds in unripe bananas, which are responsible for the characteristic chalky sensation in the mouth, can irritate the lining of the digestive tract in sensitive individuals, causing inflammatory reactions in the gut. From a nutritional standpoint, unripe bananas contain significantly fewer antioxidants than their ripe counterparts, as these beneficial compounds increase dramatically during the ripening process. For older adults who seek the anti-inflammatory effects of fruits, this decrease in antioxidant content makes unripe bananas particularly undesirable. At the top of the list of fruits that older adults should limit is grapefruit, which may sound surprising to many. Despite its image as a healthy product and a weight control aid, grapefruit can pose a serious danger to older adults taking certain medications. The danger lies in compounds known as furanocoumarins, which can inhibit the production of the CYP3A4 enzyme in the intestine. This enzyme plays a key role in the metabolism of about 85 different medications. Inhibition of the enzyme leads to the concentration of drugs in the blood reaching critically high levels. In fact, this is equivalent to receiving a much larger dose than was prescribed by the doctor, even when adhering to the recommended dosage. This effect can significantly increase the risk of side effects, some of which, depending on the specific medication, can be quite serious and even life-threatening. The list of drugs susceptible to this interaction is extensive and includes common medications used by the elderly, such as statins, atorvastatin, lovastatin, simvastatin, used to lower cholesterol, blood pressure medications, e.g. calcium channel blockers like nifedipine, anti-anxiety drugs, buspirone, antiarrhythmics, amiodarone, as well as certain antihistamines and immunosuppressants. For example, consuming grapefruit while taking the statin Lipitor can increase the drug's concentration in the blood by more than 400%, significantly increasing the risk of serious side effects, including muscle tissue breakdown and kidney failure. What is particularly alarming is that a large amount of grapefruit is not required to cause a dangerous interaction. Even half a fruit or a small glass of juice can be enough to trigger adverse effects, which can persist for up to 72 hours after consumption. Therefore, simply separating the timing of medication intake and grapefruit consumption does not solve the problem. Given the significant potential for interaction with a wide range of medications, especially those vital for maintaining the health of the elderly, grapefruit is a leading fruit that requires special caution or complete exclusion from the diet. People taking prescription medications are strongly advised to consult their doctor or pharmacist about the safety of consuming grapefruit or grapefruit juice. Don't rely on chance, as the risk of increased drug effects or side effects is too great to ignore. This seemingly harmless fruit harbors a hidden threat. Below is a detailed overview of fruits recommended and not recommended for consumption by the elderly. Beneficial fruits such as avocados, apples, pomegranates, and berries can slow down the aging process, improve cognitive function, and increase vitality. At the same time, bad fruits such as grapefruit, dried fruits, unripe bananas, and even harmless grapes can subtly drain energy, raise blood sugar levels, and increase inflammation, which negatively affects health. Most alarming is that these processes occur imperceptibly. Many people are unaware that a handful of grapes or an overripe banana can trigger a chain of negative reactions in the body until it's too late. Therefore, it is crucial to make informed choices, approach nutrition wisely, and, if possible, combine fruits with proteins or healthy fats. The author addresses the audience with keen interest, encouraging them to share personal experiences related to consuming dangerous fruits. He asks specific questions. Has anyone tried these fruits, unaware of the potential risks? Which of the presented fruits was the most surprising in terms of danger? Have viewers experienced any unexpected bodily reactions after consuming certain fruits? The author expresses a sincere desire to learn about such cases and encourages sharing stories and opinions in the comments, emphasizing that he will be very interested to read them. In conclusion, the author thanks the viewers for